if you're not freaking the fuck out by now, then you're just not paying attention.
Anyway, because they do lie terribly. We will have reduced drug prices by 1,000%, by 1,100, 1,200, 1,300, 1,400, 700, 600, not 30 or 40 or 50%, but numbers the likes of which you've never even dreamed of before.
I think the merger of military with AI and tech is a disaster on multiple levels. When I see those same tech types and the same tech companies now going to be in charge of like the new medical system, digital medical system in the US, you have to understand that all they have to do is declare a pandemic, come up with another bogus experimental injection, emergency authorized injection, declare that that is the protocol, and that anyone who talks to the contrary is now an enemy of the country. And now you've got the merger of medicine and military.
But with today's announcement, we take a major step to bring healthcare into the digital age, something that is absolutely vital. You got to do it. Moving from clipboards and fax machines into a new era of convenience, profitability, and speed, and frankly, better health for people. Under the leadership of Administrator Oz, we're officially launching the CMS Digital Health Tech ecosystem to give healthcare providers, insurers, and software companies the tools they need to empower Americans with a 21st century experience on health.
So, I mean, if you think the last pandemic was a shit show, now they're merging these tech companies into the American medical system, healthcare, so-called healthcare system, drug care system, and now they're putting those same people, the same genre of thinking, which is surveillance, control, and profitability. They're putting them into the military. I mean, the next pandemic in the United States is just going to be a Holocaust, if I'm allowed to use that word. And you've got Trump as the president right now. He's never apologized for all of his disastrous decisions. And the website of the government still says that they did everything perfectly and the injections were safe. Some people might have a little bit of allergy. Some people might have a little bit of fatigue, but it all goes away. Holy crap. So do whatever you want. My position is your location is going to determine the quality of your life. International flexibility, I think, is the new stability. America's having a lot of problems right now, faster than I can even talk about it, or even more than I want to talk about it, because obviously I'm still trying to focus on, looking at nutrition and medical science. What's going on, everybody? Dr. Vasquez here, coming to you live. This could be, and probably is, this is probably the last recording that I will make from this office space. As you can see, all of the art has been removed, including my sword and all my bows and arrows and all my beautiful art. So anyway, probably the last video from this location. And that's a good thing. It's certainly by my own choice. The purpose of this video right now, which is totally spontaneous here at 7 p.m. on Friday, August 1st, is I'm going to put a few things together for you. Maybe I'll make a more formal version of this video later. This is one of my favorite Basque t-shirts, by the way. Maybe I'll make a more formal version of this later, but here it comes right now. So I'm going to connect a few dots, which, as you know, is my favorite hobby. So I said a few weeks ago, I did a video. I think I was here when I did it. Yeah, I was. And I said, international flexibility is the new stability. And I guess that's kind of a grown-up extension of something I had said to myself many, many years ago. I think I first said this to myself when I moved from Houston, Texas to like Portland and then Seattle. Back then, I said to myself that geography becomes biology. And that's now morphed into international flexibility is the new stability. So that's what I said in one of my recent videos in last month. And then I think I did a video when I was traveling I talked about how the United States is just in a lot of trouble right now with the economy, with trade, with collapsing industry. Oh, and then getting rid of all the slave immigrant workers uh, who happen to, I think, account for 40% of the agricultural uh, either workforce or pull out of the crops or something like that. But now that President Trump is implementing all these anti-immigrant policies, the immigrants are leaving, as you would expect, but no one's pulling the food out of the crops. So you've got dying crops and dying fields of food that no one's pulling out. I'm sure you can see plenty of videos on that if you look for it. So again, I've talked for a while about how your life, the quality of your life is going to depend on where you are. That's what I meant largely when I said geography becomes your biology. And then I said, international flexibility is the new stability. And then looking at all this news coming out of the U.S. where things are just looking bad. Things are looking bad for the economy. And you can find all types of videos on that. And then we found out a few, I guess, a month before last at this point, on June 13th, 2025, that the Army, the United States Army, had now developed a new tech branch. They call it the Executive Innovation Corps to drive tech transformation. And again, this was announced on the Army website, June 13th, 2025. 4 new Army Reserve Lieutenant Colonels are this guy from Palantir, the guy from Meta, otherwise known as Facebook, Chief Product Officer of OpenAI, and another guy who's advisor at Thinking Machines Lab, former Chief Research Officer for OpenAI. So they just put these tech guys in to the Army at rank of Lieutenant Colonel, which I think is a complete disgrace. So, the way the military functions is obviously a hierarchy, and one of the bylines in any hierarchical system is you earn and honor rank. You don't just give rank away to guys who have no. You don't give military rank to people who have no military experience. I mean, it's just an insult to all the guys, to all the men and women who have fought and trained in the military, and now they're being outranked by these tech guys. I just think that's disgusting. I think it's a complete insult. They could have been brought in as consultants. They didn't need to get rank in the United States Army. That's a complete insult to all the people who have fought and died and been wounded for their rank, So I went to military high school, Riverside Military Academy, Gainesville, Georgia, and just about all of our, we had obviously a military side of the school and then an academic side, but everybody was ex-military. But on the military side of the military school, they were all mostly Vietnam vet, sergeants and lieutenant colonels, like real lieutenant colonels, like people who actually went to war. And I found this to be a complete disgrace, giving these people lieutenant colonel rank. They could easily be on the side as consultants. They don't need to be inside American military administrative positions. I just think it's disgusting. So anyway, Kevin Weil, Chief Product Officer of OpenAI, is one of the guys who just got rank in the United States Army. And then July 30th, 2025, according to Centers for Medicare and Medicaid Services, an official website of the United States government, White House tech leaders commit to create patient-centric healthcare ecosystem. So this is a merger of medicine with tech, and it includes this same OpenAI company that just got Lieutenant Colonel rank in the Army. The administration secured commitments from major healthcare information technology firms, including Amazon. Amazon is a private store owned by one guy. It is not a major healthcare and information technology firm necessarily. Anthropic, Apple, Google, and OpenAI to begin laying the foundation for a next generation digital health ecosystem that will improve patient outcomes. If you're not freaking the fuck out by now, then you're just not paying attention.
What if I told you that in 2025, your health data is doing less for you than your grocery shopping app? Hello, I'm Amy Gleason, Strategic Advisor to HHS and CMS, and the Acting Administrator of the U.S. Doge Service. Imagine scanning a QR code at your doctor's office and instantly sharing your medical history, just like when you board a flight. Imagine having an AI assistant that knows your care plan and helps you manage medications with confidence. Picture patients truly at the center of their care, building stronger relationships with providers who can focus on healing instead of on paperwork, freed from the administrative burden that technology should have solved years ago. That's not science fiction. That's what healthcare can and should look like. We're finally at a moment where real progress is possible. CMS, under Administrator Oz's leadership, understands both the urgency and the opportunity. CMS is building the core infrastructure, a national healthcare directory, secure data access, and modernized systems. But the future of healthcare technology can't come only from the government. The apps, services, and tools that make this data useful in people's lives must come from you, the private sector. We're creating the space for new ideas to rise so better solutions can compete, scale, and help real people like Morgan. Step into this space with us. This isn't just a showcase, it's a national sign of acceleration. It's about action. We're asking real companies to make real commitments, to build data sharing networks, to create apps that deliver real health outcomes, to help us kill the clipboard and give people a healthcare system that's smart and secure. Let's stop waiting and let's definitely stop faxing. Let's start building. The right data at the right time can mean the difference between loss and hope. The time is now. Are you in?
Produced by the U.S. Department of Health and Human Services.
Welcome to the 2025 C.
If you're not freaking the fuck out by now, then you're just not paying attention. I think I saw one more article on this. Let me see if I can open it. Yeah, Forbes. Forbes basically said the same thing. This was published yesterday. June. I don't know why their website's so horrible. This was published on June 31st, 2025. So this is just yesterday. White House launch, CMS and White House launch health tech ecosystem. I'm about to tell you where this is going. New chapter in U.S. health data. So here's Kennedy, the same guy. Remember, Kennedy recently said he wants everybody wearing a wearable or implanted medical device within the next 4 years. You have no idea. Most of you, I don't know if you have any idea or not, but this is about to go really bad, really fast. Let's assume that oh my God. So he wants all Americans to be wearing some type of tech gadget within 4 years. And now, oh my God, this week, the government introduced a sweeping new initiative to modernize U.S. digital health infrastructure. Over 60 companies, including tech giants like Amazon. I mean, Google, Apple, OpenAI, the same people who just got military rank, and now and major providers have pledged to support the effort. The goal: build a patient-centered, interoperable health ecosystem by early 2026. That's only 6 months from now. According to Health and Human Services Secretary Robert F. Kennedy Jr., for decades, bureaucrats, this is bullshit, bureaucrats and entrenched interests buried health data and blocked, that's bullshit, and blocked patients from taking control of their health? Are you kidding? So he's obviously now, he's just a plant. He's just a plant in the system. That's just bullshit. And for decades, bureaucrats and entrenched interests buried health data. So if you're not awake to what's going on, you need this. Here's your time. Here's your chance to wake up. And they're planning to implement this within 6 months. Early 2026. We're in 2025 right now. All right, sports fans. For those of you who haven't figured it out, I'm about to lay this out, and I'm not even making it up. I don't need to make it up. So that the same types of people and the same friends and the same buddies and the same company, OpenAI, that's going to supposedly help run this new medical system, digital medical system in the U.S., they're now also part of the military. Now, you should also notice that who's your president right now? This is Mr. Warp Speed. This is Mr. Mandatory vaccines and vaccines for everybody. He didn't make it mandatory, but he gave $17 billion to the drug companies for these experimental. And he didn't do anything to stand up for anybody. So, I mean, I don't know what kind of fool would think that this guy's going to save anybody from anything. He doesn't. He spends all his time trying to save himself. But he obviously threw America to the dogs during the pandemic. Walensky and that other woman, I don't even know what her name is, starts with a B, and Fauci. I mean, they basically ran the show, and Trump did nothing. And Trump has never apologized for that. In fact, one of the government websites recently stated that the COVID vaccines were great and very safe, and that they saved millions of people from COVID. So that's the official line that you're still getting from the government. So you may also know that I believe, as of November of this year, Europe is going to have digital currency. Okay, so why doesn't America have digital currency? And what are they going to do with that digital currency anyway? So the way that this was initially discussed is they were saying in Europe that they wanted to create what they called a digital wallet. But it was so random, they said, well, if we're going to create a digital wallet, we have to put something in it. So then they decided to put in banking information and vaccine and health information. We have friends who still live in Spain, and they're poor, and they rely on government subsidies for everything. And they used to get cash. It's a woman with 3 kids. The family used to get cash every month, and they used to get subsidized food and subsidized education and subsidized phones and subsidized computers and subsidized transport and subsidized vacations. So they get all these subsidies from the Spanish government. But in order to keep getting their free stuff, they have to stay current with their experimental injections. The other thing is, they used to get cash, and now they get digital money that expires every month. Well, you know where that's going. It's already gone. It's already there. It doesn't have to go anywhere. But in Europe, because Europe and the European Union controls its own currency, they can control people with money. They can create digital bank accounts. They can create digital euro. They can create, they can close down all the banks. I mean, that's one of the reasons why we left Spain. That's why I went back there. When was it? Last year? Was it last year? Yeah, it was last year. That's why I went back there last year, to get my money out of the banks, because the banks are so horrible. I had to get my attorney to almost sue the banks just to let me have my own money. So Spanish banks were horrible, and they've only gotten worse. But they're closing the European banks in order to push the digital euro. Obviously, see, that can't happen in the United States. Okay, so in Europe, they're going to control people with bank accounts, the digital euro. In the United States, that can't happen because the United States as a country doesn't even own its own money, right? American money is owned by the Federal Reserve, which is a private organization. So the United States doesn't even own its own money. And therefore, the government can't implement a control system. They can't implement a control grid, per se, over the money because they don't even own their own money. Now, obviously, they can do what they did in Canada, which is just have the banks pressured and closed down, just like they do with social media. They can still censor people and shut things down. But look at where this is going. The exact same, it's not like similar, the exact same company that just got lieutenant colonel rank in the Army is now going to be involved in this new health system that they're going to implement within the next 6 months. Okay, so what's going to happen at the next pandemic? What do you think is going to happen at the next pandemic? Which they're obviously still working towards. What's going to happen at the next pandemic now that you have the American medical system is going to be digitized with tech companies like Amazon, Google, Apple, OpenAI, which is the same type of people and actually the exact same company that just got Army Reserve Lieutenant Colonel rank. And this guy from Palantir, Meta, so that's Facebook. And then, I thought they had said Facebook here too. Maybe they did on the other page. Amazon, Google, Apple, and OpenAI. I don't want Apple. I mean, you have to look at the way power is getting concentrated here with health and military. What do you think is going to happen at the next pandemic if you've got a medical system run by Amazon, Google, Apple, and OpenAI? And according to this government website, Amazon, Anthropic, Apple, Google, and OpenAI, and those same people just got rank in the American Army. All they have to do is launch another pandemic, declare it a national emergency, and then state that anyone who says anything against the pandemic response, which will be coordinated through this new digital medical system, anyone who says anything against the official narrative is going to be labeled an enemy of the country or a danger to the country. So remember how bad it was in the 2020 pandemic when they closed down schools and jobs and gyms and parks and no one could do anything? They did all of that with no technology per se compared to what they're talking about now. Now they're putting these tech guys directly into the military, and now they're about to launch a new medical system in the United States that's also run by the same tech organizations and the same bloodline, basically, the same thought process. What do these people want? They want to maximize surveillance, control, and profitability. That has nothing to do with your health. Amazon, Anthropic, I don't even know who they are, what that is. Apple? So, like, I remember in the pandemic in 2021, I remember getting a message on my iPhone in Spain saying that Apple was reviewing data on my phone to verify my trust score. I don't know what a fucking trust score is, and I don't even want to have a trust score. And I sure as hell don't want them looking at. They said they were going to look at the photos on my phone to determine what my trust score was. And that came directly from Apple on my iPhone while we were in Spain. So, I mean, if you think the last pandemic was a shit show, now they're merging these tech companies into the American medical system, healthcare, so-called healthcare system, drug care system, And now they're putting those same people, the same genre of thinking, which is surveillance, control, and profitability. They're putting them into the military. I mean, the next pandemic in the United States is just going to be a Holocaust, if I'm allowed to use that word. And you've got Trump as the president right now. He's never apologized for all of his disastrous decisions. And the website of the government still says that they did everything perfectly and the injections were safe. Some people might have a little bit of allergy. Some people might have a little bit of fatigue, but it all goes away. Holy crap. So do whatever you want. My position is your location is going to determine the quality of your life. International flexibility, I think, is the new stability. America's having a lot of problems right now, faster than I can even talk about it, or even more than I want to talk about it, because obviously I'm still trying to focus on, looking at nutrition and medical science. But when I see a new medical system getting implemented within 6 months, and it's all tech companies, and then I saw these guys get put into the military, and they're all tech companies, and they're not just consultants. They've got some level of rank within the Army now. Lieutenant Colonel. I just think that's a complete disgrace. I mean, the guys who helped raise me in military school, they were sergeants. I think they were all sergeants, or at least that was their rank in the school. I don't think they would have gotten a lesser rank in the school than their Army discharge. So let's assume they were all sergeants. I remember one guy, Sergeant Beecham, and another sergeant with obviously white hair by then. Can't remember his name right now, but he was the one who taught our class in military strategy and military tactics and map reading and all this kind of stuff. But the chief of the military aspect of our school was Buckley, Lieutenant Colonel Buckley. He was a lieutenant colonel from Vietnam. So imagine being a lieutenant colonel from Vietnam and then having the same rank as these tech guys. That's a disgrace. All right, do whatever you want. I'll give you my position one more time. Your geography is going to create your biology. International flexibility is the new stability. America's got a lot of problems right now with the tariffs. I don't see any good signals. And I don't go around looking for bad signals. I just look at signals and I don't see any good ones. But I see a lot of bad ones. I think the merger of military with AI and tech is a disaster on multiple levels. When I see those same tech types and the same tech companies now going to be in charge of like the new medical system, digital medical system in the US, you have to understand that all they have to do is declare a pandemic, come up with another bogus experimental injection, emergency authorized injection, declare that is the protocol, and that anyone who talks to the contrary is now an enemy of the country. And now you've got the merger of medicine and military. That's big trouble. Again, what's happening in Europe is implementing the digital euro, so they'll just control people with money. But in the United States, because the United States government doesn't even own their own currency, they are going to use the medical system combined with military, I think, to control the people. You can sign up for that if you want. I'm not signing up for that. Make your own decisions, do what you want, take care. Bye-bye. Again, this is probably the last video from this office. So, next video will come from somewhere else. Take care. Bye-bye.
Anyway, because they do lie terribly, we will have reduced drug prices by 1,000%, by 1,100, 1,200, 1,300, 1,400, 700, 600, not 30 or 40 or 50%, but numbers the likes of which you've never even dreamed of before. And we're working very hard right now to get the other countries to lift up their prices a little bit and to get the drug companies to put it to them. And if they don't, the drug companies will have a lot of problems, and they are mostly agreed to it. And if the countries don't, then as an example, if it's Europe, I'll say that's okay. you're no longer allowed to sell cars in America. You're no longer allowed to have Mercedes, BMW, Volkswagen, or any of the other many cars. And they will say, oh, I love the idea of lower drug prices for America. So you have to use that. You have to. But with today's announcement, we take a major step to bring healthcare into the digital age, something that is absolutely vital. You got to do it. Moving from clipboards and fax machines into a new era of convenience, profitability, and speed, and frankly, better health for people. Under the leadership of Administrator Oz, we're officially launching the CMS Digital Health Tech ecosystem to give healthcare providers, insurers, and software companies the tools they need to empower Americans with a 21st century experience on health. The key breakthrough we've made is getting many of the biggest names in the healthcare and technology to agree to industry-wide standards for electronic medical records. All of those great companies that you just heard have gotten together with this group of very brilliant people. I don't know who's more brilliant, them or them. I don't know. Could be them. I hate to tell you. It could very well be them. But I don't know. I'm going to take my team. But the key breakthrough we've made is getting many of the biggest names in healthcare and technology to agree to that those standards of electronic medical records that we talk about and you've heard about for so many years, and now it's happening. This will allow patients to easily transmit information from one doctor to another, even if they're different networks and using different record-keeping systems. No matter what system they use, they're all transferable. The new standards will also make it simple for patients to access their own personal health records. I don't want to see mine, please. I don't want to see. I don't know about you. They have all sorts of things, sir. They can tell you exactly what your problem is going to be in 6 years. We can do it. You know, they have all these different things. I don't know if they work or not, but I didn't want to hear it. I didn't want to hear it. If they got a problem, I don't want to know about it right now. But it is amazing what they're doing. I don't know. Does it actually work? Can they do that? All right. Well, then I'm glad I said I don't want to know. But thanks to this announcement, healthcare providers across the country will also finally be able to kill the clipboard. It's an expression that's used, capital, with a capital C, kill the clipboard. Instead of filling out the same tedious paperwork at every medical appointment, patients will simply be able to grant their doctors access to their records at the push of a button, just a button, and you're all set, and all the information the doctor needs will be immediately transmitted. The system will be entirely opt-in, and there will be no centralized government-run database, which everyone is always concerned about. I'm less concerned than anybody. I say whatever it is, but people are very, very concerned about the personal records. They want to keep them very quiet, and that's their choice. I think it's a great thing because it'll be absolutely quiet. Instead, doctors and patients will always remain in control. The benefits to millions of Americans will be enormous. We will save time, we will save money, and most importantly, we'll save lives. It's just going to make people live longer and be a lot healthier. I think that's really what you're looking to do. And now